Dear students, welcome back. Now we are going to discuss about the conducting system of the heart. The conducting system of the heart is made up of myocardium, that is specialized for initiation and conduction of the cardiac impulse. The cardiac impulse is nothing but the action potential in the heart, which is called as cardiac impulse. Like action potentials in the nerve fibers, it can travels. The main purpose of this cardiac impulse is generating rhythmical electrical impulses to cause a rhythmical contraction of the heart muscle and conducting these impulses, whatever the impulses, the rhythmical electrical impulses which cause the contraction of the heart muscle, and those impulses are going to conduct rapidly through the heart. So these are the main and major purpose of the cardiac impulse, which are generated by this specialized myocardium. Okay, yes, and the fibers which are present in this conducting system are very much finer than the other myocardial fibers, and they are completely cross-striated. This is the difference between the remaining myocardial fibers and the conducting system of the heart. So the conducting system of the heart includes the following parts. One is the sinoatrial node. So one is the sinoatrial node. Yes. And then other one is the atrioventricular node, AV node, and also internodal pathways. So internodal pathways. So sinoatrial node, AV node, and internodal pathways, and atrioventricular bundle. This one is atrioventricular bundle or bundle of Hess, and the branches of AV bundle. So here the right branch and the left branches of the AV bundle, and finally the small fibers are called as the Purkinje fibers. So these are all the parts of the conducting system of the heart. Okay, now coming to the first one, that is the sinoatrial node, SA node. This SA node is also known as the pacemaker of the heart. It is called as pacemaker of the heart. It generates an impulse at the rate of 70 beats per minute. It generates 70 beats per minute and initiates the heartbeat. That is, self-excitation is present in such kind of conducting system parts. So these nodes will have self-excitation. Okay, and this sinoatrial node is horseshoe shaped, and it is situated at the atriocaval junction. That means at the atrium and the superior vena cava, atriocaval junction in the upper part of the sulcus terminalis. Sulcus terminalis, that part we have seen in the interior aspect of the right atrium, that is sulcus terminalis. And the impulse travels through the atrial wall to reach the AV node by internodal pathways. So it consists of three pathways. One is the anterior, middle, and posterior tracts. So this one supplies directly, this one stimulates directly the atrium. Okay, next coming to the atrioventricular node, that is AV node. It is smaller than the SA node and it is situated in the lower and the dorsal part of the right atrium. Okay, dorsal part of the right, that is called atrial septum, we can call it as atrial septum, above the opening of the coronary sinus. And it is capable of generating, this AV node is capable of generating impulses at a rate of about 60 beats per minute, 40 to 60 beats per minute. Okay, and from SA node to AV node, the rate of impulse is very fast. That means it will take just 0.03 seconds to reach from SA node to AV node. From AV node to the bundle of His, it will take some lot of time. That means it has some delay when compared to the conduction of SA node to AV node is seen. Now coming to the atrioventricular bundle, this one is atrioventricular bundle. It is also called as bundle of His. It is the only muscular connection between the atrial and ventricular musculatures. It begins at the AV node, crosses the AV ring, that is the atrioventricular ring, and descends along the posterior inferior border of the membranous part of the ventricular septum. So this bundle of His crosses the AV ring. It starts from the AV node and crosses the AV ring and descends along the posterior inferior border of the membranous part of the ventricular septum. At the upper border of the muscular part, at the upper part of the muscular part of the septum, it divides into right and left branches. So it divides into right and left branches. The right branch of the AV bundle passes down the right side of the interventricular septum and a large part enters the moderator band to reach the anterior wall of the right ventricle, where it divides into Purkinje fibers, So this is the major part, that is the moderate band. Next, the left branch of the AV bundle descends on the left side of the interventricular septum and is distributed to the left ventricle after dividing into the Purkinje fibers. So it also divides into Purkinje fibers. And these both branches mainly reaches to the apex of the ventricles. From there it divides into the Purkinje fibers. These Purkinje fibers form a subendocardial plexus. They are large pale fibers striated only at their margins. They usually possess double nuclei. So the Purkinje fibers or a subendocardial forms the subendocardial plexus. They are large pale fibers striated only at the margins. They usually possess double nuclei. Normally the myocardial cell will have a single nuclei, but this Purkinje fibers possesses double nuclei. And defects of or damage to this system results in cardiac arrhythmias. Arrhythmias means defect in the normal rhythm of contraction. Okay. And in the next pic we are going to see the conduction of the this cardiac impulse. So it starts from the SA node here. It starts from the SA node and it is having three tracks. One is the anterior, middle and the posterior, which will reach us to the AV node. From the AV node it is going to delay, and the speed of contraction, the rate of cardiac impulse is slow when compared to the cardiac impulse from SA node to AV node. And then it splits into, it is going to supply the right side and left side ventricles. So from AV node it reaches to bundle of His. From the bundle of His it divides into two, and the impulses are going to right side and left side through their branches, and this will reaches to the apex of the ventricle, where again it divides into small branches called the Purkinje fibers. And these Purkinje fibers are entering into the myocardium of all the ventricles deeply, and finally it fuses with the myocardium of the ventricles. Here the rate of conduction of the Purkinje fibers are very high when compared to SA node. In the case of SA node, the conduction rate is 1 meter per second, whereas in the Purkinje fibers it is 1.4 meters per second. So because of a lot of fibers which is carrying such kind of greater impulse, causes the pumping effect of the ventricles. Okay, and the main important function of the bundle of His is to maintain unidirectional conduction of the cardiac impulse, and this AV bundle will not allow the impulse back from ventricles to the atria, and any defect to this system results in cardiac arrhythmias. Okay, except for a part of the left branch of the AV bundle which is supplied by the left coronary artery. The whole of the conducting system is usually supplied by the right coronary artery, and vascular lesions of the heart can cause variety of arrhythmias. So these are all about the conducting system of the heart and how the conduction is taking place in the heart. Okay, so this is all about the conducting system of the heart. Thank you.